Good afternoon, ladies and gentlemen, and welcome to the program You and Health aired on Quinoxe Radio, Multimedia, and for presentation, I am Monsieur Lucille Engu. Congenital heart disease is one of the most common birth defects affecting millions of individuals worldwide, including Cameroon. This program aims to educate families and also communities on the causes, symptoms, and why not the treatment options for CHD. With me here in the studio is our special guest, but before I introduce him, I have the honor to introduce my co-host for the day, Immaculate Forge. Good afternoon.
Good afternoon to you, Lucy. Happy New Year to you.
Happy New Year.
And also Happy New Year to our millions of televiewers and listeners of Quinoxe Radio and television.
Of course, Immaculate Forge, we should know that this is the first program of the year, so
2025.
we have the opportunity to reach our viewers and listeners out there. Happy New Year.
Exactly.
And beside in the studio already is our special guest, like I mentioned earlier. He's no other person than Dr. Cabral TANTCHOU. He is a cardiologist. Good afternoon, doctor.
Good afternoon, Lucy. Good afternoon, Immaculate. Happy New Year.
Happy New Year, doctor. And straight away, without any waste of time, we are going to begin with our first question, doctor, to a layman understanding. What is congenital heart disease?
Congenital heart disease is a disease that is diagnosed at birth when the child is coming out and he can develop some kind of symptoms. Immediately we can suspect already a congenital heart disease. Now with other tests, we can really establish if the disease is there or not. Because there are some children when they are born, sometimes the color is blue, sometimes they are not breathing well. Sometimes, sometimes they are born and they are dead. You should resuscitate or you should make them to come alive. And then you go for further test, or you take the oximetry machine, O2 saturation machine, and these are tools that are helping to diagnose or not if a child is having a congenital heart disease. They are born with that. The child that is born with a particular heart issue, that one is congenital heart disease.
How then does this condition differ from other heart conditions?
The difference is obvious because you are born with. Meanwhile, some other diseases are acquired. Acquired is what is during life we can develop them, and they can be due to environmental factors. They can be due to bacteria, some infections. They can be due to poor feeding, poor nutrition. That's the main difference. Here you are delivered with the problem. Meanwhile, the other one you come to a communicable disease. It comes to you. Let me say
You
like
develop it.
Yes.
What are some of the causes of this condition?
The causes of congenital heart disease are many, mainly due to the habits of the mother. A lady that is smoking, drinking alcohol, a lady that is taking some illicit drugs, also these concoctions in villages. Sometimes, there are some ladies that they don't know that they are pregnant, they drink this, they drink that, and later on they can drink that kind of problem. If not, ladies with diabetes, ladies that are having infections like rubella, toxoplasmosis, ladies that are taking some medications like a syndrome, anticoagulation, or medicine for epilepsy, they can develop they can have children with those problems. And not only that, also sometimes we doctors, we can prescribe some medications that are having teratogenic effects in ladies. Radiation also contributes. Chromosomal changes or deletions contribute. Also, it's very important to mention also those concoctions that sometimes they take and they don't know that it can bring a problem, a harm in the child.
Now, what are some of the common types of congenital heart diseases that exist?
The common types, ventricular septal defects. Okay, the heart is having 4 rooms, 2 rooms up and 2 rooms down. The rooms up are called atria and the rooms down are called ventricles. The common types is when sometimes there's a hole in between the rooms. It can be the upper rooms or the lower rooms. But the most cases that we see in our daily practice, holes in the lower rooms of the heart, ventricular septal defects. These are conditions, and those conditions, they need mostly surgery. Surgery sometimes is necessary for the child to be fine.
Which of them is very common, and what's the prevalence rate?
The prevalence rate of congenital heart disease is like 1 per million. A child, if you are counting 1,000 children, one can come out with that kind of problem. We did some studies in Chisholm, and that's what we saw, that the incidents were not quite different from international reviews, like in one country. But if you take into consideration that Chisholm was really the center of cardiovascular diseases, a center where all patients were coming, probably that incidence can be low, or probably, I don't know, there it can be overestimated, because really it was a center where all patients were coming. These are things that we should really concentrate and start looking for the incidence. Why? Because saying it is like that, meanwhile, because, you know, where many people are gathered having the same problem, yes, it can be, it will not be the same like here in Douala.
Exactly, because everybody goes somewhere and they try to count from that number. For those who like to participate in the program, here are the numbers: 670 5470 49. I repeat, 670 5470 49, or 656 622222, 656 622222.
And back to you, Dr. Cabral. You made mention of some causes. Would like to know if the causes are related to the risk factors.
Definitely. The causes and the risk factors in our particular group are almost the same. Because if a lady that drinks, a lady that smokes, a lady that, you know, sometimes when she wants to be fine, she puts something somewhere in the vein, or she smokes the herbs.
But doctor, I have a question. Lucy, we have seen a lot of women who drink, who smoke, but they have healthy babies.
Yes, immaculate, correct.